Hi, everyone. This week we are diving into one of the first developmental stages that we're going to cover in this course, and this is the prenatal stage. So, let's talk a little bit about how we promote a healthy pregnancy for mothers. This will come in handy whether you are working with pregnant mothers. Maybe you might have a mother who already has a child in your program and you're working with her. Or if you become a home visitor someday, often they're working with prenatal mothers. So, very good information for you to have in your arsenal as you work with families. So let's talk a little bit about prenatal care. It's all about providing the care that to help the child develop healthily. I don't think that's a word. While the mother is pregnant, as well as also care for the pregnant mother. Right? We often don't think about that. We're so concerned about the fetus or the baby that we're not really thinking about the care of the mother. Currently, 77% of women in the US receive prenatal care during their first trimester. And we're going to talk about how important each of these trimesters are during pregnancy. So we can see that 77% is not good enough, right? We want mothers to be getting in to see their doctors much earlier than they currently are so that we can get those numbers as close to 100% as we can. The reasons why mothers may or may not go see their obstetrician is maybe poverty, so lack of health insurance. Teen parents often don't see the importance, or they may not have even told people yet. Language barriers, which may feel like, why should I go if no one's going to understand what I say and I can't understand what they're telling me? And then cultural beliefs. Maybe families have a belief that it's just not necessary in their family. So generally, women don't go. So those are just some of the reasons why they may not be going, and how you, as an early childhood educator, can help to maybe prompt families and pregnant mothers to be going and getting those services earlier rather than later. One of the important components when a mother is pregnant is her nutrition, right? The diet of the mother, both during the pregnancy, a little before the pregnancy, and even after the pregnancy, will have an impact on the baby. So, a healthy diet reduces the chances of premature birth, and folic acid is a crucial nutrient for pregnant women. Oftentimes, they're going to get this from their prenatal vitamins, but they should also be getting it through their food. Weight is another consideration for mothers when they're thinking about their health during their pregnancy. Typically, we want mothers to gain around 25 to 35 pounds. This all depends on the mother's BMI before she was pregnant. But if the mother does not have an adequate weight gain, she does increase the risk for a small gestational age infant, which means they're at risk for premature birth, cognitive impairments, or motor impairments. And it can even be infection and death. So that just shows why we want to have the proper weight gain during pregnancy. There's also the issue of women who may gain too much weight while they are pregnant, and that might put them at risk for diabetes, preeclampsia, eclampsia, and gestational hypertension. Right now, about 50% of pregnant women in the US are considered obese. So these are all important considerations when we're working with pregnant mothers. Stress is another factor that can impact the health of the mother and the fetus. So, pregnancy, just period, puts stress on a woman's body, but there's also a lot of hormones and things going kind of off track in a woman's body when she is pregnant. So that emotional stress can also cause issues for a mother. So we want to make sure that mothers are getting proper nutrition, rest, and physical activity during this pregnancy period, and that they have those support systems to kind of help them get the assistance that they need while they're pregnant. Age is another factor for health. Both young mothers and advanced maternal age mothers do risk certain effects for their infants, whether it's premature birth, low birth weight, and infant deaths, or infants with disabilities for teen mothers, Or when we talk about advanced maternal age, we might be talking about infant mortality, miscarriage, and birth defects. There are certain tests and things that can be performed at the obstetrician's office. But once again, that means we have to be getting those mothers in to see their doctors early and often throughout the pregnancy. So this is another thing to consider when we are working with a pregnant mother. They say the mid-20s to the early 30s is the optimal age for pregnancy. So now let's talk a little bit. We talked a little bit about some of the things we can do to have a healthy pregnancy. Now let's think about some of the risks that may be posed for fetal health and development. It all comes down to the mother's lifestyle, right? The choices the mother makes during pregnancy can have an impact on the unborn child. We want to make sure we encourage healthy choices like nutrition, exercise, sleep, avoiding stress. All of those things can help a mother to deliver a healthy newborn. But there's also some environmental substances that can have adverse effects on the unborn child. These things are called teratogens, and they can be things like alcohol, smoking, drugs, environmental chemicals, infectious diseases. And these can be really dangerous during a pregnancy for mothers. So let's dig into each of these just a little deeper. The first one we're going to talk about is alcohol. Alcohol consumption during pregnancy can lead to miscarriage, stillbirth, premature birth, and low birth weight, and even increases the risk of infant death. The alcohol is actually passed to the fetus through the umbilical cord. So the fetus is actually consuming the alcohol as well. And it can cause a condition known as fetal alcohol syndrome or fetal alcohol effect. And this causes intellectual disabilities, atypical growth, behavior, and learning problems in young children. So this is definitely something we want to combat against and let mothers know that they should not be consuming alcohol during a pregnancy. Another teratogen is known as cigarettes, right? 1 to 2 cigarettes a day can have an impact on fetal development. It is a toxic substance, and it has things like nicotine, tar, ammonia, carbon monoxide, and other chemicals that once again get passed to the fetus. So this can result in fetal malformations, birth complications, low birth weight, miscarriage, stillborn, and newborns that are addicted to nicotine, as well as it does increase the chances for SIDS once the infant is born. So we want to educate mothers on the effects of smoking during pregnancy. Environmental chemicals can also have an impact on the mother and the fetus. These can be substances such as prescription and non-prescription medications. So we want to make sure that mothers are talking with their doctors to find out which medications are safe to be taking while they are pregnant. Other environmental chemicals such as pesticides, fertilizers, metals, air pollution, and street drugs can all impact the fetus and can result in things like malformations, fetal death, premature birth, and lifelong behavioral or learning difficulties. Another thing to be aware of is communicable diseases. So the good news is that the placenta does act as a filter for some of the infectious organisms, but it does not stop them all from reaching the fetus. So the risk to the fetus really depends on the disease and the stage of pregnancy that the mother is in when they may get infected. So there is a range of complications that can result from this, and they're all from a variety of communicable diseases. So if you do have a mother in your program who does get a communicable disease during pregnancy, they really need to see a doctor so that they can get the proper treatment, and the doctor can help to mitigate any circumstances that may happen from this. So this lists some of the potentially dangerous communicable diseases, but there are more. So some of these you may have heard of, some of these you may not have. So these are all things that if you do know a mother and they have contracted one of these, we definitely want to get them in to see the doctor as soon as possible. Finally, chronic health disorders can also have an impact on the fetus, and these can be things like asthma, diabetes, obesity, autoimmune disorders. All of these can cause some risk to the pregnancy. So, we really want to make sure that mothers get in to see their doctors so that they can find out the implications and the things they can do to best support a healthy pregnancy. All right, so I hope this presentation helped you to learn a little bit about how we can promote healthy pregnancy with mothers, and will help you as you work with children and families in the future. Thanks for watching.